I have a crown, so I can't get a cavity on that tooth. Hi everyone, my name is Whitney and I'm a dental hygienist here to talk about how yes, you can get a cavity under your crowns and fillings. When you get a dental filling or a dental crown, it isn't a guarantee that your tooth is never ever going to get a cavity ever again. No, the crown itself and or the filling itself can't get a cavity since it's not a real tooth. However, your real tooth is still under there. There is tooth structure that still needs to be properly brushed and flossed underneath your crown and underneath your filling. So what is recurrent decay? Decay is another word for a cavity, and recurrent decay is the term that we use in dentistry when there is a new area of tooth decay around an existing filling, crown, or other dental restoration. The margins around your existing fillings and crowns are some of the most likely areas to experience recurrent decay. When that happens, you get a cavity under filling material that seeps deeper into the tooth than you might think. Most recurrent tooth decay is because of certain circumstances like not flossing or a super high sugar intake, things like that. You can also get a cavity under fillings or crowns when the restoration starts to get old and begins to leak around the margins. And lastly, I hate to even mention this because it's so rare, but unfortunately, it's worth mentioning that perhaps the decay was not completely removed during your restorative treatment. Again, it's more likely that lifestyle factors and diet choices were what allowed new decay to redevelop at those areas of your mouth, especially if they were already cavity prone to begin with. I guess my point is, don't blame your dentist right away. That's a whole nother subject for a whole nother video, which I'll link in the bottom bar below. But back to recurrent decay. Here are a few things to look for if you think you're getting a cavity under a crown or a filling and what to do about it. Number 1, a toothache in your tooth with a filling or crown. Number 2, tooth discoloration around your filling or crown. Number 3, your crown or your filling fell out. Normally, crowns and fillings don't fall out unless there's something wrong. Number 4, your filling or crown is sensitive. Number 5, you're having pain when eating. Number 6, floss or food keeps getting stuck around the tooth. So if you're noticing any one of those red flags, what should you do? Even if you remotely think that you might have a cavity under your crown or your filling or your bridge, get to your dentist as soon as you can. You need to make a game plan to treat the decay, if there is decay, before it can spread deeper into your tooth or other teeth surrounding it. If you just have decay under a filling, all you might need is a new filling. But extremely large cavities will oftentimes need a crown instead. Or if you have a cavity under a crown or a filling that already reached the nerve of your tooth, you might have even entered into root canal territory. In all, the earlier you treat your recurrent decay, the better chance you have of saving your tooth. And before we go, 4 quick tips on how to prevent recurrent decay. Always brush your teeth twice a day for a minimum of 2 minutes each time, focusing particularly along the gum lines and the margins of your current dental work. Floss daily. Flossing will not pull off your dental work unless it's already loose or has a cavity around it. I've had so many patients over the years tell me that they were afraid to touch their new crown. No, you need to clean it. Brush it, floss it, water floss it, all of the above. Not cleaning your tooth will give you a higher chance of recurrent decay. Use fluoride daily, either in the form of a toothpaste, rinse, or gel. Fluoride helps remineralize areas to stop the decay process before physical cavities form. And see your dentist every 6 months for an exam and cleaning. They can bring areas to your attention through clinical exams and x-rays to avoid recurrent decay altogether. I hope this video helped you. Please like and subscribe and turn on your notifications if it did. If you want more teeth talk, you can visit my website teethtalkgirl.com or hang out with me on Instagram at teethtalkgirl. And until next time, peace, love, and teeth.